Heart disease is often associated with risk factors like obesity, diabetes, and high blood pressure. But what about depression? Our health specialist, Dr. Zentner, joins us now to talk about how mental health impacts the risk for heart disease and heart attacks. There's a new study out. Tell us about it.
So the American Heart Association just last week released a position paper in Circulation about the association between depression and heart disease and advocated perhaps reassessing and pointing that depression may indeed be a true risk factor for heart disease. Why? 20% of people who present with either a heart attack or what we call an acute coronary syndrome actually have depression, as opposed to 4% of the regular population. Numbers post-discharge are as high as 30 or 40%. And in fact, for example, some studies show that as high as 30 or 40% of men and women struggle with depression post-bypass surgery, post-revascularization. So I think the call to action here is to consider the mental health piece of the puzzle when evaluating a patient's risk factor for cardiovascular disease.
So should cardiologists be screening for this, and how do they do that?
You know, my cardiology colleagues out there are going to be so excited when I recommend this kind of thing. But I think the reality of the situation is if you are a patient with depression, particularly untreated depression, it raises the sort of roof on risk factor assessment. I do think that we have to start looking at that piece of the puzzle when it comes to cardiovascular disease. So I think whether it's cardiologists or primary care physicians or general internists, that's something that we can't ignore anymore, and especially if we're thinking about risk factor paradigms. You know, we screen patients for diabetes, for high blood pressure, for high cholesterol. We address smoking issues. Why can't we address this piece of the puzzle?
So will treating depression lower the risk of a heart attack?
Great question. So there is some, you know, the question is what's the physiology? And there's some data to suggest that it has to do with brain-body chemistry that sort of activates plaques, causes blood clots to form, etc. The data on treatment of depression impacting cardiovascular risk isn't there. There is data to show that treating depression impacts mortality after a heart attack. So I would argue that I think we'll see a benefit of treating depression impacting risk factors going into a heart attack.
All right, Dr. Alley, thanks so much.